Good evening, everyone. So my next video is on the topic pharmacovigilance ADR filling. Means how we fill the adverse drug reaction which has occurred due to drug on a suspected ADR form. How we fill? I will discuss with you pharmacovigilance ADR filling. And before I start my video, I want to request you that if this video appears useful to you and if it is helpful to you, I want to request you kindly subscribe to my YouTube channel. Let's talk Kinetica Pharmacology Discussion. And now I'm going to start with pharmacovigilance ADR filling. Now, what is pharmacovigilance? First of all, it is the activity to monitor, detect, assess, understand, and prevent any obnoxious adverse drug reaction which has occurred at therapeutic concentration on animal and human beings. Pharmacon means drug, and vigilant means to keep watch or alert or to keep watch. Means we have to observe the adverse drug reaction which is any obnoxious adverse drug reaction which has occurred due to any drug which was taken therapeutically in the animals or human beings. And we have to detect, we have to assess, we have to understand and prevent the adverse drug reaction. Now, who should report? Anyone can report, like doctor, dentist, pharmacist, nurses, midwives, and health visitors. Now, this is the adverse drug reaction reporting form. First of all, the patient details, like if the name is like Paramjit Kaur, initials like PK has to be written over here. Age of the patient has to be written over here. Sex of the patient has to be written over here. Weight of the patient has to be written over here. Now, this adverse drug, suspected adverse drug reaction, when it was started, date has to be mentioned. Date when it was stopped or when it was recovered, its date has to be mentioned over here. And the proper description of the reaction means why the patient was taking the drug, what was the disease of the patient, why the patient was indicated the drug, what reaction occurred in the patient. What reaction occurred in the patient, for how many days it took the patient to recover. All these details have to be given over here. The suspected medication, like this, the name of the patient, the suspected medication which was responsible for the adverse reaction, the name has to be written over here. Manufacturer's name has to be written over here. Manufacturer, this is name of the patient, manufacturer's name, batch number, expiry date, dose, what was the dose, what was the route, what was frequency, when it was drug was started, when it was stopped, when the adverse reaction appeared, and when what was the indication. Then the challenge information, that when it was stopped, whether the direction adverse reaction appeared or disappeared. This you have to, adverse reaction disappeared or not. This has to be written over here. Here. Yes or no. And this reaction reappeared after reintroduction, re-challenge, yes or no, the information has to be given over here. Concomitant medication, other medication which was given, its details has to be given over here. Laboratory data investigations has to be given over here. Medical history like pregnancy, smoking, hypertension, diabetes, all these details has to be given over here. Seriousness of the reaction means the reaction is said serious if death has occurred, life-threatening, or hospitalization has been done, or prolonged disability to the ear, nose, joints, or congenital anomaly, any permanent impairment has taken place, any other serious event, that has to be specified and told that this is adverse reaction is serious. Outcome, whether the adverse reaction was fatal, that is, it caused death, whether it was recovering or unknown, or it was continuing or it recovered, all these details has to be given over here about the adverse reaction. Here, the reporter's details has to be filled out, the name of the patient, the professional address, PIN code, mobile number, specialty, occupation, and date of the report has to be written over here. Now, what are the characteristics of the good ADR report? Means we have to tell about the time of onset of adverse drug reaction, when it was started. What was the suspected medication? What was the concomitant medication which was given? And the demographic details of the patient has to be written. That is age, sex, weight, date of birth. Diagnosis of the event, adverse aggression has to be written over there in the report. And outcome, patient outcome, whether it recovered, whether it was continuing, whether it was recovering, whether it was fatal, all those details has to be written over there. And also the hospitalization and seriousness of the reaction has to be written over here in the EDR report. Any report investigations has to be done. D-challenge and D-challenge information has to be written properly. And other relevant information, if anything available, has to be written in the ADR report. And ADR report can be given for these drugs like herbal medicines, drugs used in children, in new drugs, in new combination of drugs, or novel routes of delivery system for drugs. Means newer drugs, their safety has to be determined, so we can give the carry out the pharmacovigilance study in the new drugs, or also drugs in the pediatric age group. Now, exercises on adverse reaction is the I'm going to discuss with you one exercise. That is, this is the patient is there, Premlata. She is 48 years and her weight is 60 kg. She has been suffering from deep pain thrombosis in the lower limb, in the right lower limb, and she was hospitalized, and she was prescribed warfarin 5 milligram once a day and enoxaparin 40 milligram twice a day for 5 days on 6/10/2020. On the fourth day, that is on 10/10/2020, she complains of severe pain in right foot, and her foot became cold and purple, and there were small punctured areas of necrosis and petechiae in the skin area for purple discoloration. The international normalized ratio was 9.6, and the patient was diagnosed as warfarin-induced skin necrosis. So enoxaparin and warfarin, they were discontinued on 10/10/2020, and the patient was given vitamin K intravenous and fresh frozen plasma to reverse the effects of warfarin, which was anticoagulant, and vitamin K is the coagulant drug, and fresh frozen plasma was given to reverse the effects of TMIN, the skin necrosis which occurred due to warfarin. Necrotic foot showed improvement on 13/10/2020, and the INR also came out to be 3.4. And this enoxaparin was again restarted along with rivaroxaban, and the patient was discharged with proper advice. On first follow-up of after 1 week, she was still recovering after necrosis of from necrosis of foot, and we have to report this ADR by the standard ADR form. These are the details of the drugs of the enoxaparin and warfarin. Warfarin is a suspected ADR, and suspected medication, and enoxaparin is the concomitant medication. So its details has been given: the manufacturer name, batch number, expiry date. Now this ADR was probably due to warfarin, that is skin necrosis, and this is the rare adverse effect of the warfarin, and on discontinuation of the warfarin and administration of vitamin K and fresh frozen plasma, the skin necrosis resolved, and enoxaparin was safely reintroduced later with rivaroxaban. This is how the ADR filling is there. Here we have given the patient's initials, age, name, date, weight. Here when the adverse aggression started, well, like it was started on 10 and it recovered on 13. 4 days was the lag period. This was the details of the reaction, how it occurred. This is a suspected medication, and this details, that is warfarin detail, its indication, and the causality assessment is probable over here because the challenge is not done here. Drug was withdrawn, yes. Reintroduced, no. So it was re-challenge was no. Enoxaparin concomitant medication is given. Its details are given. And this is the laboratory investigation details, INR 9.6 and then 3.4. This is medical history was not significant. Seriousness, as the patient was hospitalized, so it was the serious adverse reaction. Outcome was the patient was recovering. And this is the details of the reporter, like medicine department. The doctor has reported this event and this occupation and signature and date of the report and name of the receiver. This is how we fill the adverse reaction area reporting form. Now, I'm going to discuss with you another case scenario, which is the patient is suffering from the fever, runny nose, throat pain, and she was suffering, diagnosed with acute pharyngitis, and she was given paracetamol, ampicillin, and phenyramine. And the fever subsided and throat pain was reduced, but the patient developed diarrhea. Now she was given these drugs like paracetamol, ampicillin, and phenyramine. Fever was subsided and throat pain was also reduced, but the patient developed diarrhea and she came to the hospital for consultation. She was advised to discontinue capsule ampicillin immediately and diarrhea was relieved subsequently. What is the likely cause of ADR? How this problem could have been prevented? Means what is the likely cause? The ampicillin, and how we can prevent it. This is the ampicillin. It is incompletely absorbed on oral registration and it is unabsorbed portion alters the blood flora and causes the diarrhea. So we can use the prodrug of ampicillin, that is ampicillin is in its place, which is the orally used drug. Or we can use amoxicillin, which is extended spectrum beta-lactam antibiotic in place of the ampicillin. It is completely absorbed orally and diarrhea is least likely. Here, the causality assessment is the certain. Now, another case scenario is the patient is suffering from type 1 diabetes mellitus and she was given plain insulin. Today, he was given plain insulin as he was suffering from type 1 diabetes mellitus and he was prescribed in the morning plain insulin. And this patient went to play volleyball with his friend and he forgot to take the breakfast. After playing for about 45 minutes or 50 minutes, he fell ill and he fainted. Now, how would you manage this case and how would you prevent the problem in future? Now, the patient was suffering from hypoglycemia induced by insulin because he didn't take the breakfast. So he took the insulin dose, but he missed the breakfast. So we can give IV glucose or glucagon immediately. And in future, we can see that we do not give the insulin in the absence of the food. Because we have to always eat the insulin, eat after insulin. If it is possible to take the meals, if it is not possible to take the meals, insulin dose should be omitted. Means insulin should be omitted if the patient has not taken the meal. That's all. That was my discussion with the adverse reactions and the ADR filling. I hope you understood my video. And if you like this video, if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, be safe, happy learning. Thank you.